Minor anterior tooth alignment can be achieved with an invisible retainer fabricated with Invisicryl Ultra. This technique involves tooth resets of no more than 1 millimeter per stage and fabrication of the invisible retainer or aligner using the BioStar or MiniStar machines. To start, select the tooth or teeth to be repositioned. The tooth setup parameters are no more than 2 teeth per arch within approximately 1 millimeter of movement. On the patient, interproximal reduction along reset area may be required. First, the tooth or teeth to be repositioned are cut from the model using a model saw and diamond disc within a lab handpiece. Safety glasses should be worn for all lab procedures, as well as proper dust collection should be available. Cut out the tooth or teeth to be repositioned with a model saw between teeth and a diamond disc in a lab handpiece along base of saw cut, which should be about 3 to 5 millimeters below the gingival margin. Once cut is complete, remove tooth or teeth from model. With a lab knife, carve model to open voided area where tooth is removed. Do not distort crowns of adjacent teeth next to voided area on model. Also notch base of voided area with lab knife. Using a barrel burr and a handpiece, taper root area of cut tooth so it can rotationally fit in voided area of model. Also remove about 1 millimeter of root end with barrel burr. Then a diamond disc in lab handpiece or lab knife can be used to score the bottom of the tooth to help later secure to model. With a number 7 wax spatula that has been heated with a microtorch, apply melted pink setup wax to the bottom of the model void and apex of the cut tooth. Place the tooth in its ideal position, tacking in place with the setup wax. Use torch as needed to soften wax. Make sure tooth is in ideal position rotationally, vertically, and proper overbite and overjet relationship. Mix quick setting stones such as snap stones to secure tooth position for the BioStar MiniStar process. Mix stone and resin mix cup with water and number 7 wax spatula. Apply stone to model and tooth along voided areas to establish model anatomy. The stone stabilizes the teeth during thermal forming and plastic removal, as well as shields wax from hot plastic when formed. Smooth and contour stone with red sable number 3 brush. Once stone is hard, detail anatomy with lab knife. Blockout materials such as Compound 101 or Isofolin may be used at this point to relieve moderate undercuts. This will be shown near the end of this clip. The BioStar and MiniStar machines can be used to form the invisible retainer or aligner trays. Here, the BioStar scan with LCD display will be used. To start, liquid separator is applied to the model using a 3/4 inch tip brush. Two model preparation methods may be used on the BioStar or MiniStar machines. A model possessing minimal, flat trim base may be considered for use on the platform shown here. For larger models, and to minimize the thinning of material as it is formed, the pellets and cup method is recommended. To use the pellet method, remove the platform covering the pellet cup. Place model into cup with heel facing open chamber on left. Stabilize model on pellets to reference 3 to 4 millimeters below gingival margin to rim of pellet cup height. The pellets are poured around the model in pallet to block out along model to cup's rim. With a 1-inch paintbrush, pellets are swept level from reference along model to rim of pellet cup. Make sure no pellets remain on cup's rim. 1mm Invisacril Ultra will be used. Remove a disc from the sealed package along with the barcode strip and then reseal package. Remove packing film from plastic. If desired, one side of film may not be removed to function as a relief barrier against model when formed. The film side would need to be positioned upward towards the heating element when clamped onto chamber. Center the disc over the chamber and clamp material firmly in place. Press the code scan button and scan barcode strip. Recommended heating time is 45 seconds. Swing the heater over clamp material. Heating cycle will automatically begin. At the end of the heating cycle, remove heater over material. Gently flip chamber over model in pellets or on platform and lock chamber in place to start forming process. Cool under pressure for about 2 minutes. At the end of forming cycle, release pressure from chamber. Then unlock and open chamber and clamp material against chamber. Swing open chamber. Remove form material and clamping frame from over pellet cup. Knock off pellets with handle of lab knife that are attached to material while held over pellet cup. The form material on model is cut with a 3/4 inch lightning disc in a lab handpiece. The cut is made at the distal end of last molar and 3 to 4 mm below gingival margin near pellet junction on lingual and facial areas. Remove cut material around model. Remove appliance from model. Trim appliance borders to the gingival margin with the number 30 ruby carver in a lab handpiece. Facially and lingually, the plastic is reduced to 1 mm below gingival margins and terminates at the distal marginal ridge of last tooth on each side of the arch. Trimmed borders may be altered upon doctor's request. A Dymo Pro multifunctional wheel is used to smooth trimmed edges. A low to medium speed of about 10,000 RPMs is suggested. Clean trim fragments from within appliance, then rinse and dry plastic. Compound 101 is suggested to be used on arches that possess more moderate undercuts. This material can be applied with fingertips into undercut areas. This is usually done before separator is applied for the BioStar or MiniStar process. Tack model block is a thicker blockout material designed to relieve diastemas and edentulous areas on models. Isofolin material is a 1/10 mm non-stick thermoplastic that will prevent a tight appliance fit against the model. It is clamped to the chamber and formed prior to the invisible retainer or aligner plastic. Heating time is about 25 seconds. After the isofolin is formed, cooled, and chamber opened, the isofolin is cut out with a heated lab knife by a microtorch. Cut is made around outside areas of model while in pellets. Excess plastic is removed and is ready to have Invisacril Ultra formed over the plastic. Once appliance is removed from the model, the isofolin material will be peeled off the formed Ultra plastic.